everyone. Today's episode of 3 Rounds with Dr. Mike is Wrinkle Relaxer versus fillers. Today we have Nurse Katie, represents Wrinkle Relaxers, and I will be representing fillers. So, same question. Nurse Katie will answer for Wrinkle Relaxer, I will answer for fillers.
Our first question is, where would you treat with the product?
Okay, so fillers, I would say anything below the cheekbones down, preferably to use fillers. My favorite part is always the cheeky cheeks. I like doing the cheeks. I like doing jawline, chin. You still can use fillers as a part of the face, but not preferred. We still do it in the temple, we do it in the forehead, but not preferred. What about Wrinkle Relaxer?
Wrinkle Relaxer is on-label use for eyes up. We can use it for other areas on the face, but it is off-label and comes with its own set of risks and reactions.
True. Like, can you give me an example?
If we inject lower than here, we can get, like for example, around the lip area, we can get an asymmetrical smile, and it can be difficult to like blow out of a tube or suck out of a straw.
True. Sometimes we use the fillers around the mouth for the fine lines, and some patients come ask if you can use the Wrinkle Relaxer, and I always say, look, both of them has a role to play. It just both can come with some hazards. In a fine line in the lip, you can do the detox, but you use a grip in the mouth, but also you can use fillers and give a little bit of thickness to the skin. So it depends on different patients, different response.
Round 2. How long does our product of choice work for?
Okay. Different fillers in the market does have different longevity. It lasts from 6 months to up to 18 months. It depends on where we're gonna wear and also the thickness of the filler. But I would say roughly between 6 to 18 months. What about Wrinkle Relaxer?
Wrinkle Relaxer, clinical data will suggest it lasts about 3 to 5 months. However, everyone's different. So you might get a little bit of movement earlier than others, but most people get 3 to 5 months out of the treatment.
Excellent. 3.
So clinical indications other than aesthetics.
Okay, I love using fillers or any products we have for clinical reasons besides aesthetic. This is just my forte. I love it. It's enjoy it. Sometimes we had a few patients who had a motor vehicle accident, and they had dents and they have defect under the skin, and then we can lift that up using the fillers. Also, we use it for scarring as well, so we can work for underneath the scar. If you have an acne scar, which we try with microneedling and stuff and didn't work, sometimes using skin booster to lift it up, or even some a little bit thicker filler, and just if it's a deep scar, we can use a thicker filler to lift it up. So there are many other reasons, but I love it for scars, defects, cleft lip. Done that a few times, was really good. What about Wrinkle Relaxer? Can we use it for other clinical reasons besides aesthetic?
Absolutely. There's hundreds of reasons, maybe not hundreds. There's lots of reasons why we would use Wrinkle Relaxer. So we can use it for masseter reduction, for clenching and grinding the teeth. We can use it to assist with little dimples on the chin. We can use it for excessive sweating or hyperhidrosis under the arms, on the hands, and on the feet. And
many other reasons.
So many other reasons.
Yeah, side headaches. You can get also for muscle stiffness. You can inject Wrinkle Relaxer to relax the muscles. I had a patient who had the lower back, very stiff back muscle, needed a lot of Wrinkle Relaxer, but it worked very well for her. Also, there's other usage for Wrinkle Relaxer, which most probably specialists will do them. It's like, for example, anal fissures, because the muscle is very tight, and relax that. Also for sexual health, we can use that as well. So many other reasons we can use Wrinkle Relaxer and fillers. feel free to come and ask us if you have any questions. And yeah, see you again in the next 3 rounds with Dr. Mike and SK.